Hello, my name is Shane Fitzgerald. I'm a PEM Grid trainee at the Leicester Royal Infirmary, and I'm going to talk you through how to perform a PRAM assessment with some case examples, and this will enable you to recruit children to the HiFLO Acute Severe Asthma study here at the Leicester Royal Infirmary. So the study hypothesis tests the idea that early high-flow therapy improves outcomes in children with acute severe wheeze presented to the emergency department. So the high-flow acute severe asthma study is a randomised control study comparing high-flow therapy versus standard care. A study outline here demonstrates that we identify eligible children presenting to the emergency department with wheeze and then randomise them to standard care or high-flow therapy. Once they are randomised to one treatment arm, at that point they are enrolled in the study, and then once the patient is stable, we obtain consent, at which point the patient is recruited to the study. During their time in the study, we look at some primary treatment outcomes, including treatment failures needing escalation in therapy, such as high flow in and of itself, and invasive or non-invasive ventilation. We also compared the time to meeting discharge criteria in both treatment arms. Inclusion criteria for enrolment in the study include children between 2 and 11 years of age with acute severe wheeze. Previous diagnosis of asthma is not required for enrolment. And number 3, a failure to respond to burst therapy. Burst therapy here at this centre being defined as greater than or equal to 2 salbutamol nebs or inhalers administered within an hour of each other. And a failure to respond to burst therapy is defined as a PRAM score greater than or equal to 5, 1 to 4 hours after the first salbutamol dose. So to enrol children in the study, you need to be familiar with the Pediatric Respiratory Assessment Measure, or PRAM score. This consists of 5 components, including oxygen saturation, suprasternal retraction, scalene muscle contraction, air entry, and wheeze. To undertake a PRAM score, you need a stethoscope, pulse oximeter, and an oxygen sats monitor. This is your PRAM score table, including your parameters and possible scores in the right-hand column. The maximum PRAM score you can have is 12, and to enrol in the high-flow study, you need a score of at least 5. Oxygen saturation in room air is the first component. This should be measured in ambient room air. If the patient is on oxygen, you can switch off for a short period of time, but if the oxygen sats drop below 92%, you then reapply oxygen as clinically indicated, but assign them a score of 2. The second part of the PRAM score assessment is suprasternal retraction. This is a visual assessment of accessory muscle use and includes tracheal tug and denotes breathing difficulty. So absent being a score of 0, present being a score of 2. This is the part clinicians often struggle with most: scalene muscle contraction. Your scalene muscles are deep cervical muscles located on the floor of the lateral aspect of the neck, bordered by the sternocleidomastoid muscles, trapezius, and your clavicle. These cannot be seen but must be palpated for with your thumbs bilaterally to feel for scalene muscle contractions, and it feels like a band-like muscle contracting and is only present in less than 10% of cases of respiratory distress in children. Number 4, the fourth component of the PRAM assessment is air entry. Make sure you auscultate for air entry both anteriorly, posteriorly, in the superior and inferior lobes, and at the bases. If there is asymmetrical air entry, you award the score based on the worst side. Wheeze is a high-pitched whistling sound heard via narrowing of the airways, and the determination of wheeze is made by auscultation of the lung zones. So at least 2 auscultation zones must be affected to influence the PRAM score, and the 2 most severely affected areas determine the score. Other sounds may be heard on auscultation, but these must be distinguished from wheezing. Wheeze is the only sound which can influence the PRAM score. Other sounds such as adventitious sounds, rales, crackles, or rhonchi should not influence the score and should be ignored for this purpose. So just some clinical cases. A 7-year-old boy presenting to the ED with cough and wheeze receives 2 salbutamol inhalers back to back. Then on assessment, his oxygen sats are 95%. He has suprasternal retraction. Air entry is normal, but he does have some expiratory wheeze. So if we calculate his PRAM score, it would be 3, which means he would not be eligible for enrolment into the HiFLO ASA study at this time. Case 2 is a 6-year-old boy in the ED with wheeze and difficulty in breathing. He receives again 2 salbutamol inhalers back to back, and then an hour after the first inhaler is given, we assess his PRAM score. So he has oxygen sats of 92%, suprasternal retraction, no scaling muscle contraction, air entry is reduced to the base, and he has some expiratory wheeze. So if we calculate his PRAM score, it will be 5 at this time, making him eligible for enrolment to the study. Our third case is a 5-year-old girl who receives back-to-back nebulizers in the emergency department. Her oxygen sats are 95% on oxygen, but 88% in room air. She has both suprasternal retraction and scalene muscle contraction on palpation. Her air entry is reduced both at the apex and the base, and she has audible wheeze heard without a stethoscope. So if we calculate her PRAM score, it will be 11, making her as well eligible for recruitment to the study. So just to reiterate, inclusion criteria for enrolment: children between 2 and 11 years of age with acute severe wheeze, failing to respond to burst therapy defined as at least 2 salbutamol nebs or inhalers within an hour, and a PRAM score of greater than or equal to 5, 1 to 4 hours after the first salbutamol dose. Exclusion criteria would be evidence of bacterial pneumonia, such as a temperature greater than 38.5 with focal or clinical X-ray findings, impending respiratory failure needing escalation, such as non-invasive ventilation or intubation. Number 3, other contraindications to HiFLO, such as reduced conscious level, air leak, intractable vomiting, or recent bowel surgery. Other complex patients with complex backgrounds, such as cardiovascular, respiratory, or underlying neurological conditions, may not be suitable for enrolment to the study. And number 5, previous enrolment to the HiFLO study is also a contraindication or exclusion criteria. So this is an outline of our screening pathway here at the Leicester Royal Infirmary. Children presenting with wheeze to the department are identified by our visual assessment clinician or VAC nurse, and they would ask the treating clinician to listen to the lungs to see if that child needed some bronchodilator therapy. If not, the patient is not eligible for recruitment and goes down the left-hand side of the screening pathway. However, if a salbutamol neb or inhaler is given or warranted, the treating triage nurse or VAC clinician will place the PRAM stamp in the notes, prompting the screening process and the clinician to undertake a PRAM score should that patient receive a second salbutamol neb or inhaler within an hour of the first dose. If so, the treating clinician will calculate the PRAM score between 1 and 4 hours after that first salbutamol dose is given, and if the PRAM score is greater than or equal to 5 at that time, the patient is eligible for enrolment to the HiFLO acute severe asthma study. The child undergoes randomisation if they meet all inclusion criteria without any exclusion criteria, and an approved clinician trained in the study signs an eligibility form. Randomisation is undergone using the sealed envelope randomisation system, and the child will be randomised to either HiFLO therapy or standard care. And it's important to reiterate that any treatment option is available in both arms, but in the HiFLO arm they are assigned to HiFLO therapy. So for the purpose of this study, we're using deferred consent. If children are eligible for the study, they are enrolled and randomised to either standard care or HiFLO therapy. And then at a suitable time, when the patient is more stable, consent is sought. And if the parents agree to consent for to be recruited to the study. So in summary, the PRAM score is a validated measure of asthma or wheeze severity and a useful screening tool used to enrol children into the HiFLO acute severe asthma study. PRAM score has 5 components: oxygen saturation, suprasternal retraction, scalene muscle contraction, air entry and wheeze. And it's used to assess eligibility for the HiFLO study as well as treatment response. This study is funded by the NIHR and is implemented using the help of our research nurses here, Sam Hunt and Elsa, as well as myself and Damien Rowland, who is the chief PI of the study. If you have any questions, I'll place our contact details at the bottom of the show notes. Looking forward to you participating in the study. Many thanks for your attention.